Hi, everyone. Thank you for watching this presentation, Teaching Comprehensive Sexual Health Education. The purpose of this presentation is to provide educators with knowledge and additional resources to support them in teaching effective, comprehensive sexual health education. My name is Abbey Goertzen, and I'm the Sexual and Reproductive Health Program Coordinator at the Saskatchewan Prevention Institute. I will be co-presenting with Delilah Kamuhanda from Saskatoon Sexual Health. Saskatchewan is located on treaty lands 2, 4, 5, 6, 8, and 10, the ancestral territories of the Nahenawak, Nahetawak, Nahawak, Anishinaabeg, Nakaway, Dakota, Lakota, Nakota, Dene, and the homeland of the Métis. We recognize that these lands are currently inhabited by Indigenous people from across Turtle Island, including many other First Nations and Inuit peoples, and acknowledge the importance of the treaties, the lasting impacts of colonization, and the continued inequities. We are dedicated to moving forward on a shared path of reconciliation and partnership. We are all treaty people and are grateful to live, work, and play on this land. So this is a quick overview of what to expect from this presentation. First, I'm going to introduce you to the Saskatchewan Prevention Institute and the work that we do, and Delilah will introduce Saskatoon Sexual Health and their work. Then we will move into some background information to ensure we have a shared understanding of the language and principles of sexual health education. And afterwards, we will explore the comprehensive sexual health education, the Saskatchewan Health Curriculum, and finally go over resources to support you in teaching sexual health. So the Saskatchewan Prevention Institute is a provincial nonprofit founded in 1980 to reduce the occurrence of disabling conditions in children. Our mandate is to help children thrive through primary prevention and the promotion of well-being. We believe that children of all abilities have the right to the best physical, social, and emotional health possible. Our goal is healthy children.
Hello, I am the education coordinator with Saskatoon Sexual Health, and we're happy to be here with Saskatchewan Prevention Institute today. And Saskatoon Sexual Health is a nonprofit organization. We offer sexual and reproductive health education, advocacy, clinical, and abortion services to Saskatoon and the surrounding area. Our goals are to empower people to receive clinical care and make informed decisions about their own health and relationships. And we offer low barrier and accessible services to anyone that needs it in the Saskatoon or Saskatchewan area.
So a bit more background on Sask prevention. There are actually 3 types of prevention. There's primary, secondary, and tertiary prevention. Primary prevention, which is our focus at the Prevention Institute, aims to prevent disease or injury before it occurs. And in the context of sexual health, primary prevention includes things like teaching healthy relationships and consent to prevent violence and abuse, practicing safer sex to prevent unintended pregnancy and sexually transmitted and bloodborne infections, and getting the HPV vaccine. Secondary prevention focuses on detection and early intervention to minimize serious outcomes and prevent further harms. This would include treatment for sexually transmitted infection to prevent complications and to prevent passing the infection to a partner. It would also include recognizing early warning signs of teen dating violence, to intervene and prevent long-term impacts. And finally, tertiary prevention aims to manage and prevent further complications and damage, typically associated with chronic conditions. This could include long-term support to manage HIV and prevent progression to AIDS. At the Prevention Institute, we practice primary prevention in a variety of program areas, including fetal alcohol spectrum disorder prevention, perinatal and infant health, early childhood mental health, child injury prevention, child traffic safety, parenting, and sexual and reproductive health. This slide highlights more specifically how we do our work at the Sask Prevention Institute. I wanted to include this slide to outline the rigorous practices we use in developing resources and trainings. The Prevention Institute is an evidence-based organization. We're committed to finding and using best evidence in our work. We engage in knowledge exchange through collaboration with experts, service providers, organizations, and communities. The Prevention Institute uses a thorough quality assurance process to ensure, to our best ability, that the information shared is accurate, current, and of the highest quality possible. Finally, we're a learning organization that evaluates continuously to guide decision-making and ensure accountability. And these core practices will guide our discussion about sexual health education today, particularly using evidence-based, accurate, current, and high-quality resources and information.
So, how are we defining sexual health? The World Health Organization defines sexual health as a state of physical, emotional, mental, and social well being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, or violence. Sexual health is a major determining factor in well being of individuals, families, and communities. This definition of sexual health captures its broad biological, psychological, and social nature. So, when we're talking about sex and sexuality, it's important that we um, have a clear understanding of how these impact each other and what the differences are. People often have the misconception that sexual health education is focused on sex, the physiological and psychological processes related to intercourse and sexual pleasure. However, sexual health education is rooted in sexuality, with sex being a very small part of the larger picture. Um, in the image on the screen, on the slide, you can see that there is a sexuality wheel, and this sexuality wheel, which was created by Alberta Health Services, illustrates how multifaceted sexuality really is. Sexuality includes gender identity, personality, values, relationships, and body image. With this in mind, sexual health education is really about healthy sexuality. In sex ed, you will teach your students about broader concepts of sexuality and not just the biology.
So these are some of the indicators of Saskatchewan sexual health. And as a province, we don't measure very well compared to national averages. So Saskatchewan has the highest provincial rates of chlamydia, gonorrhea, and HIV, with chlamydia infections 1.5 times the national rate, gonorrhea infections more than 3 times the national rate, and HIV infections more than 4 times the national rate. Saskatchewan also has the highest provincial rate of syphilis at 5 times the national rate. And between 2018 and 2022, Saskatchewan saw a 1,444% increase in syphilis rates. We also have the highest provincial rate of adolescent pregnancy and the second highest provincial rate of sexualized violence. While there are many factors that are contributing to these statistics, in part, these rates indicate unsafe sexual health or sexual behaviors. These statistics frame why it is crucial to teach effective and a comprehensive sexual health education to all students in the province.
What is comprehensive sexual health education? Well, according to the United Nations, it is an age-appropriate, culturally relevant approach to teaching about sex and relationships by providing scientifically accurate, realistic, and non-judgmental information. The term comprehensive emphasizes an approach to sexuality education that encompasses the full range of information, skills, and values to enable young people to exercise their sexual and reproductive rights and to make decisions about their health and sexuality.
So, why is comprehensive sexual health education important? Comprehensive sexual health education is proactive, preventative, and equips young people with the information and skills they need to make informed decisions about their sexual health. It promotes sexual health and well-being, enhances reproductive health, prevents STIs, and prevents gender-based violence. It promotes sexual and reproductive health and well-being by empowering people with the knowledge to make informed decisions about their health. Comprehensive sexual health education is also a human right. The World Health Organization states that all people should be provided with the information, motivation, and behavioral skills needed to enhance their sexual health and avoid negative sexual health outcomes.
When it comes to sexual health education in schools, um, it's a complicated landscape to navigate for both teachers and youth and students. According to the Sex Information and Education Council of Canada, or CCAN, youth want their sexual health education to be focused on more than risk reduction and reproduction. They want a balanced approach that discusses positive aspects of sexuality, respects diversity, and promotes gender equality. Additionally, youth want to learn from adults they trust and indicate that teachers are among these trusted adults. Teachers are also very well positioned to provide sexual health education because they are seen as trusted sources of information and often serve as role models, advocates, and mentors. Importantly, research has shown that well planned and implemented sexual health education in schools works.
So CCAN, the Sex Information and Education Council of Canada, offers 9 core principles of comprehensive sexual health education. It is accessible to all people, inclusive of age, race, sex, gender identity, and sexual orientation, ability, or culture. It promotes human rights, including autonomous decision-making and respect for the rights of others. It is scientifically accurate and uses evidence-based teaching methods. It has a balanced approach with positive aspects of sexuality and information on prevention. It is broadly based in scope and depth and addresses a range of topics relevant to sexual health and well-being. It is inclusive of all identities and the lived experience of 2S LGBTQIA+ people. It is responsive to emerging issues related to sexual well-being and is provided by knowledgeable and skilled educators.
Checking in with your values before teaching sex ed. It's important we understand our own values and biases because what we are communicating or not communicating through silence or avoidance can influence students or communicate certain stigmas or values that can affect their views on sexuality and sexual health. It's important for you as an educator to check in and identify your own values and biases before teaching sex ed. We want to ensure we don't project our values onto our students and instead create a safe space for youth to explore sexual health and learn free from judgment. I have included a few questions on the screen to help you reflect. Before each lesson, it is good to take some time to reflect on how the topic makes you feel, your values on the topic, and the personal experiences that may have informed your values. So, do certain topics make you feel uncomfortable? Why or why not? What experiences and factors inform your own identity, sexuality, and relationships? And what are your values around sex and pregnancy? Do you project them onto others?
So, group agreements and a question box. These are tools for educators to use in teaching sexual health education. Some educators are uncertain about how to address questions about personal experiences, opinions, and values. So 2 great tools and best practices to implement with a classroom before teaching sex ed are group agreements and a question box. Group agreements are a collaborative learning agreement between teachers and students to establish mutually agreed upon expectations. Group agreements can include things like respecting others, permission to contribute or pass, questions are welcome, and the use of inclusive and scientific language. This is also a great opportunity to set personal boundaries and discuss the importance of not sharing personal experiences and not asking others about their personal experiences. Let your students know about that the learning agreement also applies to you. Group agreements are a way to make sex education more trauma-informed as well by creating trust and safety and transparency about what to expect. Similarly, a question box allows students to ask questions anonymously and help them clarify and confirm what they've learned. To help protect students' anonymity, you can also require that every student submit 1 question. And some tips are to validate students' curiosity and give evidence-based and age-appropriate answers. And if you don't know the answer to a question, it's totally okay to circle back to it and say that you will try to find the answers for them and bring it to them in the next class.
Some factors for success when teaching comprehensive sexual health education. The following are factors that when you're using these tools and resources and trying to teach in a more comprehensive way, might help you in your endeavors. First, including a variety of materials, including a variety of learning materials like print resources, videos, technology-based alternatives, and group work can be helpful to um, students with different ways that they learn and also to make things fun and diverse and mix it up. Be inclusive and don't assume students are heterosexual or cisgender, and be mindful of the diversity of bodies, including people that are intersex. Increase students' awareness and access to preventative health services and information. So highlight local resources, discuss social determinants of health, and external factors that may influence health and wellness.
So we're also going to explore the definition of sex positivity. Historically, sexual health education has been taught from a sex negative perspective. Sex negativity is the belief that sex and sexuality are inherently harmful, shameful, or sinful, and are only okay under strict norms. Examples of negative education include abstinence-only education, or shaming others for their sexuality or gender identity, and not being inclusive. On the contrary, sex positivity is the belief that sex and sexuality are natural, normal, and healthy parts of being a human. The term sex positivity can sound like it's promoting sex to some people. So some people prefer the term sex neutrality to capture the fact that sexuality is natural and normal. Whichever term resonates with you will work when you're teaching your students. But the most important part is to have a positive and respectful attitude and be non-judgmental of other people. Sex positivity or sex neutrality is necessary to create a safe and non-judgmental space for students to learn, free from shame and stigma. And I'll let Delilah speak on this last piece.
In understanding sex positivity, just important that we understand the goal is just to move towards support and having less stigma in the way that we address sexual health, but also remembering that stigma is a part of how a lot of people learn about sexual health, and is oftentimes an intrinsic part of how we think about sex and sexuality. And so we don't want to just offer support and decrease stigma. We want to actively combat stigma by naming it, talking about the shame and stigma and discrimination that might be associated with the different topics under the comprehensive sexual health education umbrella, and have those conversations with students about how stigma affects ability to get prevention, how stigma can become a barrier to health, how stigma is often aligned with marginalization and other structural determinants of health. And it really pairs well with a lot of the parts of the Saskatchewan health curriculum, which often, talk about how do barriers and access affect sexual health. All right. So why start comprehensive sexuality education early? Because it is most effective that way. So just like math or English, sexual health education is most effectively taught by building on foundational knowledge from a young age. This building block approach gives youth age-appropriate information that is expanded upon in subsequent grades and allows them to absorb information over time. An example of using this is using the scientific names for body parts, which helps children develop their vocabulary and communication skills over time. Starting comprehensive sexual health education early also promotes positive attitudes and healthy decision making in later years. When children receive accurate, evidence-based information, they are less likely to turn to unreliable sources such as their peers or the internet for guidance.
So we will also want to combat an important and pervasive misconception about comprehensive sexual health education. So comprehensive sexual health education is not associated with increased participation in sexual behaviors or increased number of sexual partners. It is actually associated with a delayed debut in sexual behaviors.
And on that note, there are other positive outcomes of CSE. Research shows that comprehensive sexual health education is associated with many positive outcomes, such as reduced risky sexual behaviors, delayed sexual activity, lower rates of sexually transmitted infections or STIs, and lower rates of unplanned pregnancy. It also prevents violence and abuse, promotes consent and healthy relationships, promotes positive attitudes and healthy decision making, and gives children and youth the information and skills they need to make healthy, informed decisions, and plays a crucial role in preventing violence, gender-based violence, abuse, and victimization.
So here we're going to quickly touch on Saskatchewan health curriculum. So there's quite a bit of room for improvement, which as an educator, I'm sure some of you have seen. So the last time it was updated was actually in 2009. A lot of it is framed from an abstinence favoring perspective, and it's generally lacking sex positivity, empowerment, gender equity, diversity and inclusion, accuracy and evidence, comprehensiveness, and I think that was it, sorry. And it doesn't explore many topics early enough or often enough, so there isn't that building block approach that is an essential piece of comprehensive sexual health education.
In terms of the curriculum, some big changes have recently come through in terms of policy that affect Saskatchewan sexual health education, and how educators approach it and the access of youth and students to this information. As a teacher, you've likely have firsthand experience with navigating the Parents' Bill of Rights or Bill 137. The Parental Bill of Rights impacts the teaching of comprehensive sexual health education in a few ways. Parents must be notified at least 2 weeks in advance of their child being taught sexual health content. The bill also restricts the distribution of sexual health resources from third parties. While third-party organizations are no longer able to present in schools, teachers can get approval from their school board to use specific sexual health resources in their classroom. Third-party resources are more likely to be approved if they align with the sexual health or the Saskatchewan health curriculum and curricular outcomes. The Saskatchewan Prevention Institute and Saskatoon Sexual Health have documents that detail the specific Saskatchewan health curriculum outcomes that our resources align with. So these documents will be highlighted in a few slides to show which outcomes align with our presentations and resources.
So in the remainder of this presentation, we're going to cover the sexual health resources from the Saskatchewan Prevention Institute and Saskatoon Sexual Health. And these are resources specifically for educators to use for themselves to inform their own knowledge when teaching sexual health education. And we will also go over the documents that show where those align with Saskatchewan sexual health curriculum outcomes. So this is our sexual health information from the Saskatchewan Prevention Institute. The Prevention Institute developed a web page that outlines much of what we've talked about in the first part of this presentation, including an overview of comprehensive sexual health education, as well as characteristics and factors for success in sexual health education. This webpage also includes information about inclusive sexual health education, including information about resources for teaching to us LGBTQIA+ youth and people with disabilities. Also, as outlined on this page, is our Teaching Sex Ed webinar series. Over the years, we've had various experts on to discuss sexual health education, everything from facilitation skills to sexualized violence to anti-racist sex ed. So if you're looking to learn more, please check out this series and the link at the bottom of the page. So the Sask Prevention Institute also has curriculum support documents. On the same webpage on the previous slide, the Sexual Health Information for Educators webpage, we also have curriculum support documents for early elementary years, middle years, and older years, which we've broken down into 4 topic areas: healthy relationships and consent, reproductive health and anatomy, diversity, identity, rights, and values, and technology and digital literacy. Within these curriculum support documents, within each grade grouping, you will find information about topics to cover and the importance to the age group, and the related Saskatchewan curriculum outcomes and indicators, and recommended resources that are available online for free. It's important to note that all of our information is evidence-based, developmentally appropriate, and expert reviewed. This is an example of the curriculum support document for early elementary years from grades 1 to 3. You can see topics to cover and the related Saskatchewan curriculum health outcomes. This next slide is some of the older ages, and it includes diversity, identity, rights, and values. And you will also see the curriculum outcomes and indicators on the far right. And then this is an example of the reproductive health and anatomy curriculum support document. It has the same format, but just wanted to show you a variety of our resources and what that looks like. The Saskatchewan Prevention Institute also has a number of print resources. These are kind of the big 4, the most popular ones. And these are the resources that used to be used with youth, but teachers may be limited in their ability to hand these out now. But as a teacher or an educator, you can use these to inform your own teaching, and they have great information on healthy relationships, contraceptives, and STBBIs. And then we also have resources to support teaching, such as a guide for understanding and teaching about consent, tips for talking with your students about building healthy relationships. We have a facilitation guide about making informed and healthy choices, and a traditional teachings DVD. And these are all available on our website completely for free. We also have numerous other resources which can be accessed via the Sexual Health Information for Educators page or by viewing our online resource catalog. And a lot of these are downloadable online, or you can order them for free.
Saskatoon Sexual Health also has some resources that can support teaching sex ed in the classroom or with youth. We have a teaching guide that goes through how to teach comprehensive sexual health education. It also covers the different resources we have available, our lesson plans, and how to utilize those in the classroom. And some examples of those lesson plans are the following pictures on the slide. So we have a puberty lesson plan and a sexually transmitted infections. We have 3 topics in each sort of age range. So for the elementary, there are presentations on healthy relationships, boundaries and rejection, and puberty and anatomy and things of that nature. Each of the 3 topics has a lesson plan, activities, a YouTube playlist, and each lesson plan kind of goes through those materials, and they're all available on our website, saskatoonsexualhealth.ca/resources. And these are also some examples of what the lesson plan looks like. So we go over what is the intended age range or grades, about how long it will take for each part of the lesson, and the learning objectives and what curricular outcomes are associated with each topic. And again, this follows the Saskatchewan health curriculum. So these outcomes are intended for these age ranges according to the Saskatchewan Education Ministry. And then some other resources we have, like I mentioned, there's YouTube playlists so that you can mix up the type of learning resources you're using, whether it's slides, print resources, or videos. So each topic, like I mentioned, elementary and then high school, we have healthy relationships, contraceptives, and STIs. So each topic has a YouTube playlist that we usually link to in the slides, but you can use it even if you're not using our slides in the classroom. And then we have some of the videos that we've made with directs that cover things like STIs, how to get testing, and things like that. And then the example of our teaching kit here, we have a contraceptive teaching kit. It includes a condom demonstrator, condoms, and then a variety of different types of contraceptives. So the pill, the IUD, um, spermicide, the cervical cap, dental dams, and other like products for sexual health like gloves and lube. So these teaching kits show students what actual sexual health products and harm reduction products look like, so they can be familiar with them, and it can sort of um, you know, make them feel more comfortable and reduce the stigma around that or the mystery around that. And it also we also teach them that, these are things that are available at your local sexual health center. So if they want to access more of these things, they know where to do so. We also have a STI testing kit that goes through like what products might you be using when you're getting testing, like a urine sample cup or a swab, things like that. And we have less of those, but we do offer for teachers or anyone to borrow the teaching kit. It's a $50 deposit that's returned when the kit is returned, or if you don't do it through cash or do it through card, we can just have your card on file. And then if you don't return it within, 2 weeks, then you're charged for the kit until you bring it back. So there are some options there, but we have a couple of these, about 5 of these available for anyone to take out if they're doing a lesson on contraceptives or sexual health and want to provide some, examples and do some tactile learning.
So this is a list of additional resources, and a few of these are resources that I referred to in the presentation. A really important one being the Canadian Guidelines for Sexual Health Education. This is available completely for free to download on the CCAN website, and you'll see that listed there. And then some other really great resources for educators, including Advocates for Youth, amaze.org, which has excellent videos, Saskatoon Sexual Health, of course, the Saskatoon Sexual Assault and Information Center, and then teachingsexualhealth.ca and Action Canada for Sexual Health and Rights.
I'll also add that CCAN has developed additional guides. They have some for um, sexual health education and supports for people with physical disabilities. They have one for youth and teens on the autism spectrum. And in that realm, we also have a collaboration with Creative Options Regina, Inclusion Saskatchewan, and Saskatoon Sexual Health called Felt Like It Is, which is modules for learning about sexual health for people with cognitive disabilities, intellectual disabilities, and those modules are free online at www.nevertmi.ca.
We'll share that in the webpage that this video is listed on.
And then lastly here, to sort of conclude what we've been discussing and tie everything together, some top tips for sex ed. One is that you don't have to know everything, and the students also don't have to learn everything in that exact moment. It's more important that you, through these lessons and through how you interact in the classroom and the community, that you establish yourself as an askable adult. And by askable adult, we mean someone that students or youth in your life see as open, approachable, caring, and welcoming of questions or curiosity. So they know based on how you discuss sexual health and sexuality, the way that you have approached these lessons or topics, that you're someone that they can go to if they need resources or support or have questions, so that they're not turning towards more unreliable sources to answer these questions. Next, we have don't panic. Sexual health can be something that makes us uncomfortable, but don't panic. You have resources on your side. You have the curriculum to guide you through what outcomes are most important for you to address, and you have lots of local organizations to support you in this work. And from, what we know from the research, it's that making sure that you're well prepared and have those resources is going to establish more comfort. And also by addressing things with comprehensive sexual health education, not only are you meeting some of the curricular outcomes, but you're addressing the things that youth actually want to learn from an evidence-based perspective. So you have the curriculum on your side, you have the evidence, you have the research, you have the youth needs on your side when you approach things from this comprehensive sexual health education perspective. Ask questions. So if these say something that you don't understand or there are questions that you need further clarification on, it's okay to ask questions to make sure that you're answering things in the best way or providing information that actually meets their needs, and things of that nature. Uh, Keep things accurate, honest, short, and simple. Just straight to the point, and simple is always best. And if further clarification is needed, they will ask or um, put a question in the question box so that you can expand on those things. Remember that norms changes. So what might have been normal for you in your community or in your generation might not be normal for the kids of today, or maybe that norm has changed in some way. Um, Also using teachable moments that are outside of the sex ed lesson, because establishing communities and cultures of like consent, respect, and autonomy are things that stretch outside of sexual health lessons. Um, Also, like was mentioned earlier, you can always answer questions the next day. So if there's questions in the question box that are complicated or that you want to research or that you need to go over again because maybe they make you uncomfortable, you can always say, put questions in the question box and we'll go over them the next day, or after the lunch break or something like that to give yourself some time. Remembering that along with the don't panic, humor is your best friend. Um, these topics can be serious, but doesn't mean that we have to approach them entirely from a place of, um, you know, seriousness. And humor is your best friend. It will make you feel more comfortable. It'll make the youth more comfortable. And again, it can make the lesson fun and more approachable if you lean into the fact that, yes, this is a little bit awkward, but we're working through it. And also, like we mentioned earlier, using a question box. Having some anonymity there, whether it's a virtual question box or a physical question box, it can really help to make sure that the things that need to be addressed are being addressed through providing anonymity to students to ask whatever it is they may need. As someone who has often used question boxes in classroom settings and programming, this might be where students, disclose something serious happening in their lives or ask questions that relate to their lived experience. And so it's a really good way to make sure that the necessary questions are being asked, and students really enjoy the option to use an anonymous question box.
So that brings us to the end of this presentation. On this slide, you can see our contact information. As you can tell from this, just speaking, Delilah is fairly knowledgeable, so please reach out to her with their information on the bottom here. And you can see mine there and my role. Anything else you want to add, Delilah?
I think that's everything. If you are looking for any of our resources, our website's skprevention.ca or Saskatoon Sexual Health.ca. You can find all of the things that we mentioned on there. Um, I believe like we also link to a lot of the additional resources we mentioned in our own resources on the website. And yeah, it was lovely to present with you. And as she mentioned, reach out if you need anything.